deviance is an objective method. So here there is one 0 to 100 continuum. A range will be given. For example, it's like uh, for intelligence, to measure intelligence, 90 to 110 is a so 90 to 110 is considered as an average intellectual ability. So that has an universal value. Yes. So that has a standard set of range or norm to define intelligence. So in the same way, to measure a person's trait, intelligence, personality, or attitude, or any attribute of a person, attribute of a behavior, to measure that, we use some statistical analysis. So if a person's behavior is deviating, if a person's measure is deviating from that statistical device, then we can consider this as a deviant behavior or unusual pattern. But there are certain limitations for this statistical deviance. We can't completely 100% rely on this statistical deviance. For example, how we are measuring the statistical deviance in this 0 to 100 continuum. So whatever it is, every attribute will have certain range, statistical range. So if it is above or below to that particular norm, can be considered as deviant behavior. But sometimes what happens, we'll take the example of this intelligence only. So if a person's IQ level is above than the average behavior, 90 to 110, we are considering it as an average. If it is above or below, we have to say it is deviant, away from the normal range. But how we can measure if the if an intelligence is more than 120, 140? So we don't actually consider this as a deviant behavior. We actually says the person possesses uh, genius intellectual ability, high intellectual ability, and we are considering it as a positive aspect. Yes. And in the same way, the same intelligence, if it is below 50 or 40 or 20, we are considering it as MR, mentally retarded. Yes. So those activities are, we can say that the person face challenges in daily functioning, making like they don't even, not even able to uh, deal with their own activities. Yes. So mentally retarded. So here, statistical measurement is not always useful to consider this abnormal behavior, but still we can use the statistical methods or objective methods to assess the behavioral pattern of an individual. Yes, not in all the scenarios, but wherever it is possible, this will give a reliable information about the behavioral patterns of an individual. Then personal distress. So first one is about societal standard. Second one is about statistical deviance. And the third aspect to identify this deviant behavior is personal distress. So personal distress, which refers that when an individual experiences significant suffering, yes, and this suffering gives an discomfort, yes, discomfort to their thoughts, feelings, and emotions, and interfering their day-to-day activities. Yes, the person, for example, a person lost their loved one. Yes, he or she is in grief or sadness or something. So if for some period of time the person is going through this grief, we can accept, okay, we can understand. But the same sadness or grief is continuing for a longer period of time, prolonged time, and interfering his day-to-day activities, like his personal activities, his professional, it is disturbing his professional life, personal life. Then we need to address the issue. Yes, we can say it is not just a sadness, but this might be a symptom of a depression. Yes. Then maladaptive behavior. This is very important concept. So to understand most of the unusual behavioral patterns, first we need to understand this maladaptive behavioral patterns. So this maladaptive behavior is uh, which hinders a person's ability to adapt and function in their daily life. Yes. So whatever they are doing, they reduces the ability. For example, if a person unable to uh, use their intellectual ability, reasoning ability. Yes, if the person is highly uh, overwhelmed in their emotions. Yes, so their cognitive process will deteriorate. They can't take a proper decision. Yes, so this adapt whenever they are losing their adaptive functioning and interfere their ability to deal with the situation. Yes, overcome with any problem. So then we can consider this as a maladaptive behavior. And sometimes what happens if a person is in a stress? Yes. So there are two ways. Uh, what academic related stress? Okay. So how they can overcome? They have to study. Once they are confident enough, they know the answers, they can solve their problem. Instead of studying, the student adopting some other methods like ignoring the subject which is difficult for the student. So to what extent at that moment they might be relieved from the stress. Yes, they might be stress free, but later this will add more stress to that individual. So these can be known as maladaptive behaviors. This is not only about education, we can take in every aspect. Like, for example, people to overcome their stress, they indulge into alcohol or any other drugs or something. Instead of resolving the issue, they are using something else, which gives a temporary solution for the problem. Yes. We do even see that people who suffers with this social anxiety is unable to face the society or unable to face the people, so they go on try to ignore the people. Yes, ignore, either they'll try to ignore or they just try to leave that place. Yes, so they cannot uh, face the situations or face the people. So this might lead to maladaptive pattern or maladaptive behaviors in an individual. So all these we need to in other ways we can understand. So if we see this is all what is the help of abnormal psychology. Brain should be how did they diagnose? We'll just observe. So early age of superstitions. So in the ancient era, we can say that in the ancient era, uh, behaviors at that do now if we there are now there are so many societal pressures, so many work related pressures, academic or job related. So due to all these, people are facing psychological disturbances or something. Earlier it was not there. This is not the scenario. Even in the ancient times also, people used to go through all these psychological disturbances, but their perspective was different. Now there are people are aware of psychologists, psychiatrists, they are consulting. Yes, they are taking the treatments, therapies and all. But at that time, people's opinions and perspective towards people who are suffering with these psychological disturbances were totally different. So we'll just give a glance over what exactly people's opinion at that time. So if we observe this early age, at this ancient times, it was abnormal behavior was often attributed to supernatural forces. Yes, people used to think all this unusual behavioral patterns are taking place because of this supernatural forces. So people used to believe in spirits, demons, or other supernatural entities possessed individuals. That's the reason they are exhibiting all this kind of uh, behaviors, unusual behaviors. Yes. So this supernatural perspective was there, was the supernatural. They used to strongly believe that supernatural forces were responsible for this abnormal behavior. So, according to their perspective, according to their belief, they used to treat the people. Yes. So now we are believing that because some environment factors are responsible or personal factors are responsible, so we need therapy. At that time, their belief system was supernatural forces which are responsible for this behavior. So if we observe the treatment, how they used to treat these people, based on their belief system, their treatment procedure was also very weird. So there was a technique. Usually, uh, they use this technique called trephination. Yes. So this trephination was an ancient practice where they used to what make a hole. They used to drill uh, into a person's skull and make a hole, and they used to believe that they are allowing this supernatural forces through this. They are venting it out. Yes, they are making a hole, so they are giving a space to that evil spirit to leave from the brain. So ancient belief system was like, it's totally because of this evil spirits. So they used to think that brain is the storehouse of them. So if they make these holes, they used to make these coin size holes, and there was evidence that people used to survive for long years even after with that hole. Yes. So this was an inhuman treatment. So without any anesthesia, without anything, they used to make this holes in the skulls and made used to believe that a supernatural can leave from their body. Then treat this. So shamans and spiritual healers, they used to perform these rituals to clear, uh, clear or cleanse this individual's evil spirits. Then, if we observe this, so it's a early age. It's all about supernatural past. Then next comes to this middle age. So this we can say here it is a naturalistic approach. People used to follow some naturalistic approach at this middle ages. So here during this the Greek and Roman periods, what happened? There was a shift. We can say from this supernatural uh, belief system to naturalistic explanations for this abnormal behavior. Yes. So they used to strongly believe that there were, because at this era, we can observe there are so many philosophers or physicians. Like if we observe at this time, Hippocrates was there, who actually started viewing that mental disorders are stemming from natural causes, not because supernatural forces. These are stemming from natural causes. And yes, and he used to like these natural causes are nothing but bodily humors. So first, Hippocrates was known as a father of modern medicine, and he used to believe that every human being will have all these four bodily fluids like black bile, yellow bile, blood, and phlegm. So whichever the humor is dominant in a person, they will exhibit certain pattern of behavior. Yes, behavioral patterns are totally dependent on these bodily fluids. So if there is any imbalance takes place, yes, in the functioning of these bodily fluids, that might lead to this unusual behavioral pattern in an individual. Yes, at least he is not believing that some divine forces are responsible for this unusual pattern. He says person himself, and that too, those bodily fluids are responsible. And uh, he totally classified these mental disorders into three categories. Those are mania. Mania is nothing but excessive excitement and euphoria. So these bodily fluids are responsible for these categories of abnormalities. Then melancholia. So melancholia is profound sadness or depression. Yes. Then third one is phrenitis. So this is totally about inflammation of the brain, which leading to delirium or fever. It's a brain fever, we can say. So this Hippocrates fluid concept of fluid was used for so many years. Yes, it was very much popular. Then another person in this era was Galen. So he was also one of the influential Greek physician. So he actually expanded these Hippocrates theories, and he emphasized the importance of physiological factors in health and illness. So he used to strongly believe that stress and emotional turmoil could impact physical health if a person is taking. This is now, even today, we are also believing that stress will definitely impact our physical and psychological health. Yes. So at that time, at the 16th, 17th century, people Galen introduced this concept, like if a person is taking a lot of stress, that will affect his mind and body. So he uh, he actually did a groundwork for the biopsychosocial model. Yes, biological factors, psychological factors, and social factors will responsible for abnormal behavior or mental health of an individual. Then, after this, the third aspect, the next one is Middle Ages. So again, after this naturalistic phenomena, again this Middle Ages, here we can say that this is a return to superstitions. Again, there is a dominance. Yes, why it is happened? Because fall of the Roman Empire. Yes. So because of the fall of this Roman Empire, we can see the reappearance of this supernatural explanations for abnormal behavior. Yes, people started believing on these supernatural forces, and this treatment were completely under the influence of this Catholic Church. So church used to dominate. They used to give preachers. They used to make people believe about this demonic possession and witchcrafts. Yes, and treatments during this period were often harsh and punitive. Yes, it's totally a punishment for this. It's totally inhuman and very much punitive at this era, we can say. So here we can see this, the witch hammer was a, can say it's a manual published in 1487 for identifying and prosecuting witches. Yes, now we are using DSM-5, yes, ICD and all. At that time, this was the manual. Witch hammer was a manual to understand the unusual behavioral patterns. So what happens? So this, according to this manual, the period's reliance on superstition were believed that abnormal behaviors were the result of witchcraft. Those accused of witchcraft were often subject, uh, they used to, according to this manual, they need to be tortured, and uh, that is the way. If we can torture in a different way, these evil spirits will leave that body and the person will be relieved from those unusual behavioral patterns. Exorcism was also become very popular at this time, very popular and become very common during this period. So the treatment for these people, it was like they strongly used to believe that they are possessed by demon. So the treatment was, it's like treatment was given by the priests, and it's like uh, priests used to pray for that. They used to pray, they used to do certain rituals, and they even sometimes they used to use some physical coercion also to treat these people. Next, after this era, we can see this Renaissance. So the Renaissance marked a return to scientific inquiry. Again, back to this scientific era. And here we can observe it is more human-like treatment. And here at this period, we can see the establishment of asylums, yes, which were initially at period of middle age and period of early age, it was totally inhuman. People used to torture, they used to tie with chains and all, and make holes and all these process used to take place in asylums. But now at this renaissance, at this era, this asylums were more human, like the present hospitals. There were good facilities were provided for those people, maintained with uh, cleanliness and humanly treatment. Yes. So it is more scientific in nature. Then at this era, we can see one hospital in London, that is Bethlehem Hospital in London. So this is very much famous. So this is considered as an early asylum to treat this mental disorders. So this was established in 13th century. So yes, there were so many reforms were taken place at this era. That's the reason it is called scientific. In late 18th century, a French physician, Philippe Binet, advocated for more human treatment of the mentally ill. So he famously, what he did, he unchained the patients. Yes, this kind of treatment was started with him. Unchained patient hospitals in Paris and emphasized need for compassion and moral treatment. that was totally absent in the previous era. Then in the 19th century, we can see American reformer Dorothea Dix. He campaigned for the establishment of state hospitals and better conditions for the mentally ill. So her effort has a significant improvements in mental health care in the United States. Yes. So 18th and 19th century, we can say that laid a stone for the betterment of this treatment, diagnosis procedures, identifying all these mental health issues and establishing a good hospital. Okay. In this 19th and early 20th century, there were so many scientific advancements were taken place. Now, in the early 19th century, Sigmund Freud's theory was introduced that has laid a foundational stone for understanding how this childhood experiences influences a person's behavior. And now, century and early 20th century, there were so many um, therapeutic techniques, various psychotherapeutic approaches were introduced, such as behavioral therapy, cognitive therapy, humanistic therapy. So, from supernatural belief to naturalistic approach, then humanistic approach. After that, understand causes and introducing the new therapeutic approaches. So this was the what we can say journey of this abnormal psychology from 12th, 13th BC to till up to 20th century. So now presently, uh, how we are actually classifying. Okay, this Hippocrates classified into three categories about this mental illness or disorders. But presently, what criteria we are following to classify these mental illnesses? Yes. So, sorry. So, to classify these mental disorders, now we are using DSM. Yes. So, DSM is nothing but Diagnostic and Statistical Manual of Mental Disorders. So, this was published by American Psychiatric Association. So the primary guidelines used by clinicians, researchers, and psychoanalysts to diagnose psychological disorders. So this can be useful for all these people, how to classify psychological disorders. What is stress? How to differentiate stress from anxiety, from depression, and all these things. So DSM is a manual for us to classify the psychological disorders. So we can say it is a standardized tool. It has its reliability, validity values. So we can say it is very much standardized in nature. So DSM-4 TR was introduced in 2000. It is a multi-axial. It used to follow the multi-axial system. So this multi-axial system is nothing but there are 5 axes, like 5 categories. In that, first one talks about clinical disorders like depression, anxiety. Axis 2 talks about personality disorders, intellectual disabilities. Third talks about general medical conditions. And fourth axis talks about psychosocial and environmental problems. Fifth one talks about global assessment and functioning. So after this, people identified like there are so many difficulties while classifying the disorders. Like so, because so many causes for so many psychological disorders and symptoms were overlapping. It finding very difficulty to identify and classify the disorder. So to overcome this problem, in 2013, there was DSM-5 was introduced. Yes. So this is an DSM-5 is an unified classification. So here, in this, we can observe this axis 1, 2, 3 were totally collapsed and they have become a single axis. Yes. So what exactly we are doing? Here we are integrating psychological and medical conditions into one category. Yes, physical and psychological aspects into one category. So if we have to define this, what exactly a mental disorder is, according to this DSM-5, what exactly the mental disorder is? It is a behavioral or psychological syndrome. Yes. So syndrome, when we use this term syndrome, a group of symptoms that often appear together. So a group of symptoms. So whenever a person is in stress or in anxiety or in depression, we observe certain characteristics. So all these can be considered as a syndrome. Then behavioral or psychological syndrome in an individual. Then we can say how this are reflects an underlying psychological dysfunction. Yes, what kind of psychological dysfunction is taking place in an individual? Then what are the significant causes for this uh, dysfunction? Then uh, whether it shouldn't be a common response to a stressors or culturally sanctioned events. If we are saying yes, usually the person responds in that way, so we are not supposed to consider this as a disorder. Yes. Then yes. So there are so many changes has taken place from DSM-4 to DSM-5. I'm not discussing all those in detail now. For example, we can say I'll just give one or two examples over here. First one is this multi-axial system. Second is elimination of schizophrenia subtypes were eliminated. Then gender identity disorder renamed as a gender dysphoria. Likewise, there are so many changes has taken place. So with these changes, presently we are using DSM-5 TR. Next, DSM-5 uh, uh, manual only for psychological disorders. So all the categories of psychological disorders were mentioned in DSM-5. There is one more manual, that is ICD, that is International Classification of Diseases. Here, this ICD is published by World Health Organization. So this is an international standard for diagnosing health conditions, then introducing this mental disorders. So it is globally, uh, it is used globally for, we can say that this is used for epidemiology, health management, and clinical purposes. So both like physical as well as psychological problems, both were mentioned here. So doctors, nurses, healthcare professionals, nutritionists, psychologists, psychiatrists, uh, all these people belongs to different fields can use this ICD. Yes. So in this ICD, only one part is dedicated for psychological disorders, unlike DSM. So this is all about our unit 1. It's all about the nature, definitions, how we can conceptualize normality, abnormality, what are behavioral patterns, what is the historical background, yes, what is the classification systems we are presently using, how it was evolved. This is all about unit 1. So your unit 2 talks about different approaches. Yes. What are the various approaches to understand this maladaptive behavior? So psychological illness is nothing but a maladaptive behavior. So maladaptive is nothing but a different from the normality. Yes. So which is unusual, which is not matching the standard. Yes, that we call it as an maladaptive behavior. So there are various perspectives to explain these behavioral patterns, yes, behaviors. why it is happening, what is the cause for it. So uh, if you see, first one is about biological perspective. So the reason could be like biological perspective in this abnormal psychology emphasizes that bodily disturbances can cause disordered behavior, disordered or disorganized behavior. Yes. So bodily disturbances, if uh, what we can say that uh, like hormonal disturbances, we will discuss in detail. So here, the main perspective of this biological aspect emphasizes more on bodily disturbances that cause this disturbance in their thought process, in their behavior, in their cognition. Yes. So this ideology or this viewpoint gained a popularity in the 18th and 19th centuries. Yes. So because we already discussed in this 18th and 19th century, there was an advancement in because that is known as a scientific era. So many scientific advancements were taken place over there, like advancements in anatomy, physiology, and genetics. So because of this developments, it suggests that biological causes are responsible for this disorders, psychological disorders. So causes can be, according to this viewpoint, the causes for this maladaptive behavior can be uh, genetic abnormalities or anomalies which present at birth that cause permanent damage. Yes. For example, if the child immediately after birth, if a child unable to get oxygen for a few seconds, then that will impact a lot for their uh, brain growth, brain development. So likewise, if any birth defects, that might cause a permanent defect, psychological defect. Or we can say some genetical causes, yes, genetical disturbances or something. Then certain injuries or infections, those also, certain brain injuries, certain infections also cause for these psychological problems. Then we can say that what uh, temporary physiological malfunctions. For example, if a person has uh, paralysis or some injury to spine or something, this also leads to uh, certain psychological disorders. For example, if you see this temporary uh, disturbances, it's like if a person has a high fever, which lead to delirium or confusion. So this delirium or confusion also considered as a psychological disturbance. So high fever is responsible for that. Then, so how the physiological functioning is taking place and nervous system functioning of the brain and nervous system, endocrine glands. Yes. So this hormone producing glands, this affects the mood and behavior. Yes. For example, if we see that adrenal gland dysfunction contribute to anxiety disorder. Yes. And we can say this nervous system like abnormalities in the prefrontal cortex linked to schizophrenia. Likewise, biological aspects are directly or indirectly responsible for this psychological disturbances. So, biological perspective says that definitely uh, there could be a reason. Yes, some biological reason will be there to there for this psychological disturbances or mental health. The next one is about psychodynamic perspective, which is emphasized by Sigmund Freud. So he explained about id-ego, superego, and so many other concepts. And he emphasized more on childhood experiences, traumas and all. This will influence a person's behavior later life. So the connection between this id, ego, superego, which one is dominating, that one also influences uh, the person's thought process, behavioral processes. So psychodynamic has an important uh, they have given an important concept of experiences, childhood experiences. So not only like not the biological causes, but these one also responsible for mental disorders. Then behavioristic perspective. Yes. So this behavioristic perspective emphasized that all behaviors are learned, can be unlearned. Yes, behaviors can be learned and unlearned at the same time. So this approach, this perspective's primary approach is concerned with observable and measurable behaviors. Yes. So what we can see, say, genetic factors or some other factors which we can't observe. Reason should be like when we are saying this is uh, abnormal behavior, unusual pattern, which we should able to observe, which we able to measure it. Yes, it should be empirical. So their main behavioristic perspectives main focus is on this empirical approach, which should be observable and measurable rather than this internal mental states. So this behaviorist view development as a according to them, the development is a continuous process where individuals play a big role. So environmental factors, social factors do play a role in this psychological disturbances. So I have, for example, stress. What is the reason? Maybe there is so much of work, pressure he's undergoing. That's the reason is leading to the person is there. So behaviors more on this external, which is stimulus response aspect. So these behavioral models, which are developed by this Pavlov, Skinner. Yes, Pavlov introduced this conditioning, how we learn through conditioning. Skinner explained about how this reinforcement. Yes, because all mental psychological disturbances are part of learning the unhealthy behaviors. Yes, unusual behavioral patterns. How we are learning? Maybe in some situations it is through conditioning, in some situations it is through reinforcement. Maybe it's a positive or negative reinforcement. Try to, uh, we are using reinforcement to get the reward or avoid the punishment. Yes, we are learning that. So, uh, these behavioral models, whatever we are discussing, these models are particularly effective. We cannot say that it is not effective or something. It is effective in treating certain behavioral disorders and impulse control issues. These issues and disorders, such as excessive drinking or obesity and sexual problems. So, these behavioral perspective is helpful treating all these uh, types of psychological disturbances. Then the next important approach is cognitive perspective. So biological perspective talks about physiological aspects, how they are responsible for the mental health. Behavioral aspect talks about how environmental stimulus are responsible, how people learn or unlearn the behavioral patterns and how it lead to psychological. acquiring the language and problem solving. So how this focuses on higher order mental process. So this says that how people process the information and it emphasizes the importance have any role. But here, in cognitive perspective, how the person is analyzing the stimulus, how the person is understanding the stimulus, that is responsible for this psychological disturbance. So the key concepts of this cognitive perspective is nothing but cognition, which emphasizes the process of knowing, yes, knowing the stimulus, attending the stimulus, thinking, remembering, yes. So fantasizing and consciousness, it's all about the cognition, yes. Then uh, the second important aspect is how you are processing the information. Yes, how an individual process the information. So that is from like how they intake the information, how they store and how they retrieve like their childhood experiences, how they are stored their childhood experiences and how they are using it presently. Yes, all these are talks about this cognitive perspective. So important aspect of this cognitive perspective is given by Aaron Beck. He proposed different uh, psychopath, psychopathologies, which characterized by maladaptive schemas formed from adverse early childhood experiences, or we can say learning experiences. So, which can be responsible for this distorted thinking process. Yes, like anxiety, depression, and all these things. So for that, we are using cognitive therapy. So we are rewire, we are what we are changing the thought process. Yes, irrational thoughts or irrational behaviors or emotions are rationalized. Okay. So next important concept is about humanistic psychology, which focuses more on humanistic perspective. It's a we can say that positive view of human nature. Yes. So their main perspective is giving utmost importance to human being. Yes. According to humanistic perspective, this says that individual has all the capacity to think, to analyze. Yes, their